Good afternoon. I am Lisa Williams, and I am a instructor for our Masters of Science nursing program. I have with me here Regina Rich. She is a student working on her Master's in Education, and she is going to participate in a skills lab today on showing everyone how to access properly a portacath or central venous access device. So I'm going to talk Gina through it, and we're going to go through the whole process, and then she will give a return demonstration. Okay, are we ready?
Yes.
So, what would be the first thing you would do, Regina, before you access this port?
So I would introduce myself to the patient and um, identify her as the correct patient, and I would tell her what I was doing with her with accessing her port.
Okay, and what's the next very important step that you do before you touch your patient?
So I'm going to wash my hands
Okay,
with soap and water or use the Purell.
okay, very good. All right, so the next thing we want to do is uh, we want to make sure that we look at or we assess the site. Make sure that everything, you can see the borders, you can see that there's no redness, no swelling, um, no drainage or anything abnormal around this site. So you can go ahead and
Okay.
simulate washing your hands and getting ready to
So
begin.
I washed my hands.
Okay.
Before I touch my patient, I'm going to put my gloves on.
Okay, now you want to make sure that you have all your equipment available for this procedure because it is a sterile procedure. And once you don your sterile gloves, then you will not be able to move to go get anything. So you want to make sure you have everything at the bedside that you need.
Okay, so I would have my port access kit.
Okay,
I would have two of my sterile normal saline, 10 ml syringes only, and my microclave.
very good. Okay, so you have all your equipment and you've introduced yourself to the patient. You've washed your hands. Okay, so your very next step would be what?
So I would assess the site, and so
Very
I
good.
was looking for redness, swelling, any abnormalities if the person has pain at the site.
Okay.
And then I would ask her what size needle that she uses.
Okay.
So it feels like she has about a 3/4 inch needle. So if she told me that, and I could also identify that in her chart.
Okay, so now what else will you ask this patient before you put any chemicals or anything on their skin?
So I would ask her if she has any allergies, and I would check her allergy band on her wrist to see if she does have any allergies. And if she had allergies to the prepping solution, then I would use, per our policy, an alternative.
Okay, very good. Okay, so let's begin.
Okay.
First thing you want to do is you want to take your kit. And as I said, this is a sterile procedure. So you want to make sure you open your kit using sterile technique. Okay, now there are items that's going to be on the top in your kit that you don't have to keep sterile until you open your sterile fill. So how would you handle that?
So I would take my sterile gloves, put them to the side.
Very good.
I would put my mask on.
And why are you putting on a mask?
Because I want to keep the area as sterile and aseptic as possible, and breathing on that area could cause infection.
Exactly. Okay.
And so I have this little drape that I would try to open up as sterilely as possible. As sterilely as possible. Which these are kind of hard to open sterile. So when I tried to put this, if she had a Johnny, I would try to put this on her, underneath her Johnny. Not so easy.
Yeah, well, that part of it is actually aseptic. You just want to make sure you're keeping the area clean. So that's not going to be sterile, so that's okay.
And so I would have a garbage nearby to throw unessential items in here. And so since this needle is sterile, I'd put that off to the side.
Okay.
And then I would open up my kit as sterilely as possible. So normally
Okay. So now you have your sterile field. So everything within that sterile field is clean. Okay. You haven't put on your gloves yet. So now you want to take all of your other items and put them on the sterile field using a sterile technique. So you're not touching the inside. So go ahead and open all of your equipment that you will need and put it onto your sterile field.
So I'm going to open up my needle. I would open up my 2 10 ml syringes. I would open up my microclave.
Okay. Now, what's your next step?
I would probably wash my hands again if I
Okay.
felt that my hands weren't clean or if I touched anything.
Okay.
Then I would grab my sterile gloves.
Okay.
And I would open up my sterile gloves sterilely. Put my sterile gloves on.
Okay. Very good. So now you're sterile. All of your equipment is sterile. So you're able to touch anything you need to do. So the next step, you want to make sure that you flush your port. I'm sorry. You want to make sure that you have everything that you need to flush your port once you access the device and check for your blood return. So go ahead and let's move on to the next step.
Okay. So I would take my 10 ml syringes and I would try to get all the air out. And I'm going to flush my needle.
Very good.
And then I would flush my microclave.
Very good. Very good. Okay. Now, the next step is you want to clean the site. And what do you use to clean the site?
I was use the ChloroPrep.
Very good.
And I'm going to clean back and forth side to side.
For how long?
For 60 seconds.
Very good.
Okay. And I would tell the patient, I'm going to clean your site for 60 seconds.
Okay. And in your cleaning, you want to make sure that you do what? Do you want to lift it up and down, or how you want to make sure that you maintain contact with the skin?
So I'm going to make sure that I always have the ChloroPrep always touching the skin and moving back and forth side to side, bigger than the size of the dressing.
Exactly. Very good.
So, has it been a minute?
Yes, in 60 seconds.
Okay, so I would discard this in the garbage.
Very good.
Let it air dry. So could I possibly say clean it first and then prep the equipment instead during that time, because waiting for it to dry?
Yeah, as long as you maintain your sterile technique,
Okay.
in the order you want to do it is fine.
Okay.
So that would be a good way. Let's assume that it's dry.
Okay. So now I would grab my needle with my 10 ml syringe, and I would tell the patient that I'm going to access her port. And I would take the sleeve off. Now this one hand will now be unsterile. So I'd have to grab hold of the port. And so I think per the
And
policy.
you're feeling for the borders of the port.
Right.
Okay.
So 90-degree angle, straight down. You're going to feel a pinch.
Excellent. Now, what you need to check for at this moment?
So I need to check for a blood return.
Absolutely.
So I pull back. I'm getting a blood return.
Okay.
And now I'm flushing.
Okay. And how much are you flushing with?
I'm
And what solution?
flushing with 10 mLs of normal saline.
Okay. Very good.
Making sure not to get any air. And then I'm going to clamp.
Now, since that, you want to make sure that your needle is in and secure. So what's the next thing you're going to do?
I'm going to make sure I put the dressing on.
Very good.
And I'm going to try not to have any ridges in here and try to make the seal as perfect as possible so that bacteria is not able to get into this site. I think it doesn't want to stick so well.
Yeah, you cleaned it really good. and you made a good point. You might want to go ahead and prep your site while you're preparing your syringes and give it a little extra time to dry. Okay, so now what's your next step? You have your syringe on the end of your um, catheter. Doesn't matter. As long as your green light's on. Okay.
And so now I'm going to use my other 10 ml syringe.
Exactly.
And I'm going to flush with my microclave because I don't want the end to not have something before I hook it up to fluids.
And what you want to make sure of before you take that syringe off?
That I'm not touching the area, and if I do, then I would use a chlorhexidine scrub to scrub the site for 15 seconds per policy.
Exactly. You want to make sure that you're clamped so that you get no
right.
air into that line.
Right. Oh. So now I'm going to make sure all the air is out of here. Connect, unclamp, and flush.
Very good. Now, what is it very important to do to that dressing so that you'll know um, when it needs to be removed?
Oh, right. So I'd need to document with this little thing that's in here the date for the dressing to be changed. So since today is the 4th, I would have to make sure it was 7 days from today. So the 11th. And put my initials on here and then document in the medical record that I accessed the port.
Perfect. Okay.
I probably have to do this part with my gloves off.
Yes. And now that you have the dressing on there, you can take your mask off as well.
Oh, okay.
So now we see how to safely and with sterile technique access Porticath, which is a type of central venous access device. And the next step will be a return demonstration that you will do, a practice one, and then we'll do one for your grade.
Okay.
Thank you, Regina.
Thank you.